everybody. Today our topic of discussion is on the craniotomy. See, craniotomy. What is craniotomy? Otomy means opening and crani is related to the word cranium. So, opening is made into the cranium. Okay, or you can say is an operation in which a small hole is made in the skull, or a piece of bone from the skull is called a bone flap is temporarily removed from the skull to access the brain. Why we do this craniotomy? See, the craniotomies are often a critical operations performed on the patient who are suffering from the brain lesions such as tumors, who's having the blood clots, and for the removal of the foreign bodies such as bullets, and the patient who's having the traumatic brain injury. Okay, let's discuss. So, craniotomy is a surgical procedure that involves an incision through the cranium to remove accumulated blood or a tumor. Or what are its complications? See, the complications of these procedures include increased ICP from the cerebral edema, hemorrhage, obstruction of the normal flow of CSF, that is your cerebrospinal fluid. Additional complications include hematomas, hypovolemic shock, hydrocephalus, respiratory and neurogenic complications, pulmonary edema, and wound infections. Complications related to the fluid and electrolyte imbalances include diabetes insipidus and inappropriate secretion of antidiuretic hormone. Okay. Next, here you can see this is the craniotomy procedure in which a small hole is made into the skull and the piece of the skull called the bone flap is removed, okay, to access the brain. Okay, like this we can access the brain. Okay, so this is your durameter. Okay, so we can say it is a complicated operation or a surgery, critical operation. So what you have to do before the surgery, pre-operative intervention. See, explain, first of all you have to explain the procedure to the client and family. Ensure that an informed consent has been obtained by the surgeon. You don't have to take the consent. You just have to ensure that whether it is taken or not. Okay. Prepare to shave the client's head as prescribed and cover the head with the appropriate covering. Stabilize the client before surgery. Okay. Next, what you have to do after the operation? See, you have to monitor the vital signs and the neurological status every 30 minutes to 1 hour. Monitor for increased intracranial pressure, monitor for decreased level of consciousness, motor weakness, or a paralysis, aphasia. Aphasia is a language disorder caused by the damage in a specific area of the brain that are responsible for language. Okay, so visual changes, personality changes, maintain mechanical ventilations and slight hyperventilation for the first 24 to 48 hours, that means you have 1 to 2 days, as prescribed to prevent increased intracranial pressure. Assess the physician's orders regarding the client's positioning. Avoid extreme head or neck flexion and maintain the head in a midline neutral position. Provide a quiet environment. Monitor the head dressing frequently for the signs of drainage. Okay. Next, about the drainage. See, mark the area of drainage at least once each nursing shift for baseline comparison. Monitor the hemovac or a Jackson-Pratt drain which may be in place for 24 hours. Why? Because these drains remove any blood or other fluids that might build up in that area. Okay. Maintain the suction on the hemovac or a Jackson-Pratt drain. Maintain drainage from the hemovac or a Jackson-Pratt drain every 8 hours and record the amount and the color. Notify the physician if the drainage is greater than the normal of 30 to 50 ml per shift. Notify the physicians immediately of excessive amounts of drainage or a saturated head dressing. Record strict measurement of hourly intake and output. Maintain fluid restrictions at 1500 ml per day as prescribed. Then monitor the electrolyte values. Monitor for dysrhythmias which may occur as a result of fluid and electrolyte imbalance. Apply ice packs and cool compressors as prescribed for periorbital edema and ecchymosis of one or both eyes, which is not an unusual occurrence. Provide range of motion exercises every 8 hours. Place anti-embolism stockings on the client as prescribed. Administered anticonvulsants, antacids, corticosteroids and antibiotics as prescribed. Administered analgesics such as codeine sulfate and acetaminophen as prescribed for the pain. So this is all about craniotomy. So in our today's topic, we have discussed about the procedure, what is craniotomy, what are its complications, what are the pre-operative interventions, and what all are the post-operative interventions. So I hope this small video is clear to you all. Thank you. Have a good day.